Hello, I'm Dr. Ann Rhoten, owner of Kentucky Audiology and Tinnitus Services. Do you have tinnitus? Have you been told there's nothing that can be done? Healthcare professionals continue to tell sufferers that there's nothing that can be done for their tinnitus. There are things that can be done. This short educational video will help you learn about the mechanisms of tinnitus and what treatment options are available. I hope this will help you with your tinnitus. Welcome to this short educational seminar about tinnitus. My name is Ann Rhoten. I'm a doctor of audiology and an owner of Kentucky Audiology and Tinnitus Services. I have over 23 years of experience in audiology and want to help people with their tinnitus. What is an audiologist? A lot of you may not know what an audiologist is. But an audiologist is the primary care giver for people who have hearing loss, balance disorders, tinnitus. We do treat adult and children, and we do evaluate, diagnose, and treat those disorders. Audiology has been recognized as a highly sought-after career, one of the best careers in 2006, 2007, and 2008. Interestingly, in 2011, it was voted as one of the least stressful careers. However, I would like to formally protest that sometimes it is a little stressful. We do, at the current time, require that an audiologist has a doctorate. There are different ones that can be obtained. You can get an AUD, which is what I have, a PhD or a PsyD, which are typically research-oriented degrees, and typically those people with those degrees will work in a university setting. And we do have to be licensed by our state in order to practice audiology. And we are trained in hearing loss, tinnitus, and balance disorders. But recently, it has become so, there's so much information out there now that practitioners are specializing in some of these disorders. So some people specialize in hearing loss, some in tinnitus, and some in balance disorders. An association was created just for tinnitus practitioners to certify them and to support them. It's called the Tinnitus Practitioners Association, or the TPA for short. I am certified by the Tinnitus Practitioners Association. I have much post-doctorate education in tinnitus and continue to educate myself as often as possible in management of tinnitus and related disorders. In addition, I am also certified by Pavel Jastreboff, who is the creator of Tinnitus Retraining Therapy. So you're watching this probably because you know somebody who has tinnitus, or maybe you have tinnitus yourself. Tinnitus is different than many disorders because you can't see the person suffering. You know, somebody has a broken leg or poison ivy or something like that. It's obvious. You can see them walking on crutches. You can see the rash on their arm. But with tinnitus, the people suffer in silence, making it difficult on people. But you're not alone. There are lots of people who have tinnitus. Reports suggest that about 50 million Americans report tinnitus. Not all of those are debilitated by it. The research shows that about 17 million are significantly affected or debilitated by the problem. It is the number one disability that veterans are reporting coming back from Iraq and Afghanistan. And these statistics are consistent all over the world. If you go to any country, the percentages are about the same. So, why you really came to listen to this is, what is tinnitus and what can be done about it? Tinnitus is a perception, and it is a real perception of sound when no sound actually exists. It is a benign condition. For most people, it only lasts a few seconds or maybe a few minutes. However, there are others that have it constantly. 94% of the population report having tinnitus in a quiet enough environment. There was a classic study in the 1950s that put normal hearing people in a sound-treated room, and they were to report if they heard anything. And 94% of those normal hearing people heard some sort of noise in their head or ears in that quiet environment. Most commonly, people report that it's ringing in their ears. If you say, do you have tinnitus, they'll say, I don't know what that is. But if you say, do you have ringing in your ears, then they, oh yeah, I have that. But it is described in many, many different ways. It can be described as ringing, hissing, crickets. Some people will say cicadas. Some people will say it sounds like the ocean in their head, or roaring. And some people actually report music. That they hear a certain tune, and a few people will notice that they hear voices, and now that we need to be really careful about. If you hear voices that are telling you to do something, that is not a form of tinnitus. But these people who experience music sometimes feel like they hear distant mumbling voices. Can't tell what they're saying, but it sounds like voices to them. That is a form of tinnitus. And many people are afraid to report the musical tinnitus and the voice tinnitus because they do believe that might be a psychotic episode. But only if you can understand what the voices are saying to you is that a psychotic episode. And closely associated with tinnitus, is hyperacusis. Hyperacusis is sound tolerance problems, where normal everyday noise that most people don't even pay attention to or can tolerate, somebody with hyperacusis cannot tolerate those noises. And the reason it's important is because about 40%, and this is hard to determine, but about 40% of the people who have tinnitus also have some sort of tolerance issues. And tinnitus can be very debilitating. Some are bothered by it, and some aren't bothered by it. Remember, 17 million people, about 17 million people, are significantly affected by it. But that means that there's about 36 million people who have it but aren't bothered by it. My husband is one of those people. He says he has it 24/7. At any time, if I say, can you hear your tinnitus, he can stop and listen and say, yes, he can hear it. But for the most part, he's not bothered by it and he doesn't pay attention to it. But those 17 million people on the other side of this chart pay attention to it. Those people will often say they're aware of it 70, 80, 90, 100% of the time, and that they're bothered by it when they hear it. 15 million people, still function even though they have it and they're bothered by it. But about 2 million people in the United States are so affected by it that they can't work, they change their lifestyle, they change their social interactions, because of the tinnitus. Jack Vernon, in 1976, Jack Vernon was a psychologist, and in 1976 he created the Oregon Health Sciences University Tinnitus Clinic. And as a part of this clinic, he started a database to keep records on everybody who had tinnitus, and they gathered thousands of records, and these are just the results of those records, that database that of the symptoms and the lifestyle effects that people who suffer from tinnitus have. And the top three, of course, are concentration problems, relaxation problems, and irritable or nervous. So it can significantly alter your lifestyle. People change jobs, they change their marital status, they change how they interact socially with people. And so it is a significant problem for these people. So, is there a cure? Some say that there is no cure. I like to contend that if I can make you belong to the group who's not bothered by their tinnitus, that was a cure. However, in the strictest terms of a cure, there is no cure. We're not going to make the tinnitus go totally away where you never ever hear it ever again. However, many people, healthcare professionals included, are telling patients that there is nothing that can be done. They have to learn to live with it. And not only is that not true, but it certainly can cause some exacerbation of people's symptoms by hearing that they have no control and that there's nothing that can be done. And there are things that can be done, and we're going to get to those in just a little bit. Many people who suffer from tinnitus have tried many different things. There's lots of things out there that tout that they can cure tinnitus. I saw an article. It wasn't an article, it was an advertisement in our paper, our local paper, that said that you could cure your tinnitus just like you cure a headache with aspirin, and all you had to do is take this pill. If it sounds too good to be true, it probably is, so you need to be careful about that. But there are many other things that say that they work besides medication: surgery, masking, electrical stimulation, laser stimulation, acupuncture, relaxation therapy, just to name a few, some of them more effective than others. Here's just a picture of some of those things. Some of them are devices, some are vitamins, and it can be very, very confusing trying to sort all this out. The first thing that I would recommend to you, if you ever decide to take any of these medications, be sure and talk to your physician about them, because they can interact with other medicines that you're taking, which can be very dangerous, and so you do want to be careful about what you take. The other issue that you want to be concerned about is that most of these are only about 40% effective in any research that they've done. And if you know anything about the placebo effect is about 40%. So when any study comes out to be, say it's 40% effective, you cannot rule out that that was just the placebo effect. There does not tend to be any scientific evidence about any of these medications. But there is hope. The current research is showing that a combination of counseling and sound therapy can remove or reduce the perception of your tinnitus. Most people in these studies got to a point where they only noticed their tinnitus about 10% of the time, and even when they did notice it, they were not annoyed by it. It didn't bother them. And these have been backed by research studies that have shown that they are better than 80% effective. I know personally some clinicians who have better success rate than even 80% with their patients. So this is effective. Of course, audiologist, being the healthcare professional who treats hearing loss and tinnitus and balance disorders, would be the logical person or the logical professional to help with this condition. And we're going to go more into sound therapy and counseling in just a little bit. But to start with is what causes tinnitus. And here are a list of some of the conditions that can cause or exacerbate tinnitus. some being very benign like earwax, and others more serious like hypertension and head trauma. Some of these diseases or these causes can be easily treated, as in anemia, as in allergies, as in earwax. Others a little bit harder, hypertension and diabetes, but all of those things can be controlled and help you reduce the perception of your tinnitus. Some of them a little more serious, like head trauma, but they can be treated and get rid of the cause. Tinnitus is not a mental condition in itself. It is just a symptom, and it is a normal process of the auditory system. Remember when I told you just a little bit ago about 94% of the people in a quiet enough environment will get tinnitus, which tells us that that is a normal process. The ear is doing what it's supposed to do. But most of the time what these conditions do are that they cause little structural changes in the inner ear structures, and this becomes the source of the problem. So let me tell you just a little bit about the ear. Most people think of the ear as what's on the side of your head, and that's what we usually say, your ear. But that's just part of your ear. That's the outer ear. We have a middle ear and an inner ear, and then we have the auditory pathways that take the sound to our brain. The outer ear is the part on your head, and then the ear canal. The middle ear is from your eardrum to the inner ear. The middle ear is all air-filled, and those are where those three little bones that are the smallest bones in our body live. Though when the sound hits the eardrum, it vibrates those three little bones, which takes the sound then to the inner ear. The inner ear is all fluid-filled, and that's the cochlea. There's the cochlea with the little blue lines through it. It's snail-shaped, and when those three little bones rock, they move the fluid that's in that inner ear. But where the blue line is on this picture, that is where the inner and outer hair cells are, and the hair cells are sheared and moved as that fluid moves in the inner ear. And when that fluid moves, and when those hair cells are stimulated, the nerve is stimulated, and the signal is sent to through the central auditory pathways to the brain, where we perceive a pattern. But those little hair cells in the inner ear can be damaged, and when they're damaged, they can change the signal and make it unclear, or they can change it in some other way. It's like the fluid bombarding those inner and outer hair cells. It's like walking on the grass. If you continue to walk in the same path every single day, the grass no longer springs back. If you walk once or twice, the grass does spring back, but the more we walk over it, the less likely the grass will continue to grow and prosper. Eventually they're matted down and dead, and you have dirt there. And that's what happens after continual bombardment of the outer hair cells. Well, when we get damage to those hair cells, then because of how the central auditory pathways work, it tries to compensate for these weakened signals, and a pattern starts that's not supposed to be there, and it creates a sound perception that's doesn't have an external source. But it's actually non-auditory structures that exacerbate and make people be in that group that are debilitated and significantly affected by their tinnitus, and not just in the group where they have tinnitus but they're not bothered by it. So I mentioned Dr. Jastreboff earlier. He is a neurophysiologist who postulated the mechanisms of tinnitus and he called it the neurophysiological model of tinnitus. It says that the structures in your cochlea or in your inner ear, where those hair cells are, get damaged, and that then central auditory pathways change the signal, but it's these non-auditory related brain structures that actually cause tinnitus to emerge and be maintained as a debilitating condition. So what are those non-auditory structures? The first time I saw this slide, I had no idea what it meant, and I hope that it's not too overwhelming for you. But the auditory periphery down in the left-hand corner is your cochlea, and that's where that damage starts, in those outer hair cells. And when we go up to our auditory subconscious, we all have filters, if you will, that filter out information all day long, sensory information from many different sources. Cars going by your house or by your place of business. Most of the time we don't notice them. We filter them out because our brain knows that that's not important, and that's what the auditory subconscious does. We do that with other sensory stimuli too. The clothes on your back, glasses on your face, your watch on your wrist. For the most part, we don't notice those things unless something changes about them. If something changes, then they will go up into the auditory and cortical areas and be perceived. But if it's habituated to, then it won't be. There won't be any perception of that. So when you get the tinnitus signal, if you don't think this is odd, this is scary, there's nothing I can do about those. If you don't think those thoughts, you may perceive it a couple of times, but eventually your brain will be like, it doesn't need to pay attention to that. It'd be like the traffic noise. It'd be like your refrigerator hum that you don't really pay attention to unless you get up in the middle of the night or unless it changes, and then we notice it. If we go to the right of the auditory subconscious centers, those filters, if you will, to the limbic system. Our limbic system is the system in our brain that is responsible for all of our emotions. So fear, sadness, happiness, all of our emotions are in the limbic system. And if we have an emotion related to the sound, then it is going to go up to those cortical areas, and we are going to have a perception of it. So, but that can be positive or negative. In your auditory subconscious, if you hear a sound or say a song that has a happy memory, your limbic system is going to send that on to those cortical areas where you are going to perceive it. Or if the sound has a negative connotation, like the hissing of a snake, that's something that limbic system is going to let pass through to those cortical areas, so we perceive them. Our autonomic nervous system down on the bottom right is the system that's responsible for all of our automatic processes, if you will. Our breathing, our heart beat, sleep, digestion, all of those processes are regulated by the autonomic nervous system. So if we have a fear of something, if we see a tiger sitting in the room and we're afraid, our autonomic nervous system gets activated and we get hot and our heart rate might go up and we might run out of the room. That's the autonomic nervous system. It's the fight or flight. But it's also responsible for our rest and our digestion. So if our autonomic nervous system in the fight or flight mode is activated, we have trouble with resting and relaxing. And that in turn makes us perceive things more as well. So the people who get tinnitus and then put no meaning to it, it becomes a neutral signal, actually what we call habituate to the tinnitus signal, and so they do not perceive it. The people who put meaning with the tinnitus, they are unable to habituate because they put meaning behind the tinnitus signal, and so they continue to perceive the signal. And the more that they're told there's nothing that can be done, or that this is scary, there could be something wrong with them, all of those things keep them perceiving and reacting to the tinnitus. So, although the original damage or insult may have occurred in the ear, the tinnitus continues because of what happens in those subconscious and conscious parts of the auditory system. And so it's what happens between the ears that makes tinnitus a problem, not what actually happens in the ear. Now that we know this, we know that there are things that we can do to reduce the perception of the tinnitus. As we already talked about many times a day, we tune out things that don't bother us because they have neutral signals. And that is exactly why you hear some people say, yes, they have tinnitus, but it doesn't bother them. And hearing that from somebody who suffers from tinnitus is oftentimes enough to put some of these people in that suffering category as well. You know, what's wrong with them that they're bothered by it and somebody else isn't. But they've just gotten other structures involved in the tinnitus perception, and they just need a little help to habituate, which comes naturally to some people. So in order to see if you are a candidate for habituation therapy, or what's called tinnitus retraining therapy, there are many names by which it goes by, but essentially we're helping people to habituate to the tinnitus signal. You need to have an individualized treatment plan. And in order to find out what your individualized treatment plan is, you must have an evaluation and a consultation and then the recommendations for treatment. Every single person who has tinnitus is different. There are never two people exactly alike in their perceptions and their reaction to tinnitus. And so it's very important that you have this individualized evaluation and consultation. The evaluation, we need to find out about your hearing sensitivity, your reaction to tinnitus, and your sound tolerance levels. And we do this by many different self-administered questionnaires and handicap inventories, a very detailed case history and interview, and a review of the self-administered questionnaires, and then an audiological assessment, which not only tests your hearing, but also does specific tests to determine your tinnitus pitch and loudness, and then some tolerance testing to see if you're one of those people who have sound tolerance issues along with your tinnitus issues. In the consultation, we review all of those subjective measurements, the questionnaires, the case history, the inventory. We also review the objective measures, which are the hearing tests, the tinnitus measurements, and the sound tolerance evaluations. And then, as a part of the consultation, we do some instructional counseling about your measurements and what they mean, and then we make recommendations based on all of that information. There are many different things that can be recommended. There's a big continuum because some people are not bothered as much as others. Some people have sound tolerance issues and don't. Some people have hearing loss and some don't. And so it's very individualized. But some people will need just some instructional counseling. Some people will need instructional and cognitive counseling. Some people will need sound therapy. Sometimes people just need lifestyle recommendations. And some people need to be followed on a regular basis. The counseling part, the instructional counseling is about the mechanisms of tinnitus. And some of it we've talked about a little bit, but it's much more in depth. How tinnitus occurs, what causes it to be exacerbated and maintained. And then the cognitive counseling is about your thinking and your reaction to tinnitus and how that affects your tinnitus. And then sound therapy can be just sound enrichment. People turn on a fan, open a window, turn on a radio, is sound enrichment, making your environment much less quiet. And then for some people, we need individualized instrumentation for their specific issues. And what sound therapy does, by turning on a fan, by opening a window, by turning on music, or by wearing individualized devices, you decrease the contrast between the tinnitus and the background sound. It's what we call a dark auditory room. If everything's very, very quiet, your ears are going to be dilated wide open to pick up every single sound they hear, including your tinnitus. But if you lighten the auditory room, brighten the auditory room, your ear doesn't pay attention to the quiet little sounds as much because of the difference in the contrast. But it also interferes with your detection of tinnitus. You also decrease the gain in the auditory system. You also do tune activity in the autonomic nervous system. And you create a distraction, and you can provide relaxation by providing sound therapy. This is just an illustration of what sound therapy does in a dark room, an auditory dark room. The candle is very, very bright, as is your tinnitus, very, very bright. But if you add light into that same room, the candle is still noticeable, but it's not the only thing you see. You can see it if you choose to, but for the most part you don't notice it. And that's what happens with your tinnitus in a lightened auditory room. You may be able to pick it out, but it's not as noticeable because the sound in the environment has been enriched. This is just a example. When there's not very much information, the tinnitus really stands out. But when you fill the page with information, the tinnitus is easily picked out. It's not as noticeable. That's how contrasts help. So sound therapy can be in many different ways. People who are not very bothered by their tinnitus may need just some generalized acoustic environmental enrichment, like a tabletop sound generator, sleep pillows. Just turn on a fan or a water fountain. There's lots of tabletop fountains now, and music, an iPod or MP3 or radio. But some people who are further along the scale, who are more bothered by their tinnitus, may need actual ear-level sound generators. They may need amplification. They may need combination units. There's also some different kinds of sound devices, one called Neuromonics, another called Sound Cure, that deliver sound in a different way, not quite as flexible as the individual sound generators. So, what can you do? 1, avoid silence. 94% of people in a quiet enough environment experience tinnitus. So the more you enrich your environment with sound, and that doesn't mean to overload it, but just to keep low level noise will help you not notice your tinnitus. Don't overprotect your ears. Do use ear protection in loud environments like lawn mowing and music and power tools. If you work in a factory or if you hunt, it's very important that you use ear protection, but not in inappropriate situations sitting in a quiet room. Do things that you enjoy. The more that you get involved in what you're doing, you can get your mind away from tinnitus. And make an appointment for a complete evaluation to see whether you need this therapy or not. There is hope. You are in the right place. I thank you for listening to this short webinar. If you have questions, you can call the office at 859-554-5384. There is a link on this website that you can get an appointment by clicking on that link. There are forms, and thank you for listening.